Welcome to Developing an Effective Language Access Plan. This is the third webinar in our Language Access Planning series. We're delighted today to welcome Olivia Garcia from Casa de Esperanza to help us move forward to action, exploring what information is needed to develop and implement a comprehensive language access plan. As mentioned in the webinar registration email, we have two upcoming technical assistance phone calls. Thursday, November 21st from 12 to 1, and Wednesday, December 4th from 3 to 4. There will be specific discussion topics and an open Q&A. More information will be sent out after this webinar. We will also set the date for the next webinar very soon as we head into the rest of our planning year. We recently sent a language access survey to the executive directors of all funded programs to help our office better understand what language access currently looks like across the state and to help guide future trainings and resource development. We ask that one person from each organization who is knowledgeable of your community's language access needs, your agency policies and practices, and your outreach efforts to complete the survey by the end of Wednesday, November 13th, which is today. Please prioritize this if you have not had a chance to complete that survey. I'm going to turn this over to Olivia, and welcome to the webinar.
Hi, good morning, everyone. I'm Olivia Garcia, and I'm so excited to be here with you all and to discuss language access planning. As we know, this is such an important aspect of the work that we do to make sure that survivors have all of the resources that they need. So I'm from Casa Esperanza. I hear that you all have had a good background on understanding who we are. We're a small group of activists, Latinas, that started a shelter in St. Paul, Minnesota in 1982. And from then, Casa Esperanza has just continued to grow. So we focus quite a bit on Latino, Latina, Latinx communities, if you're using the new X version. And we seek to end domestic violence in our community. We focus on 5 different core values, which include Latina leadership, entrepreneurship, organizational excellence, living free of violence, and community-driven solutions. And so we recognize that community is what will end domestic violence, and that's why it's so important for us to continuously work with community. We also emphasize developing social capital like trust and social capabilities, trust, reciprocity, information, and cooperation, because that's how we think we will decrease domestic violence. And so now that you know a little bit more about our values, these have led to the creation of the National Latino-Latina Network, which is a project of Casa Esperanza that is working to end violence and promoting health and the well-being of within Latinos and communities around the country. And so we are a national resource center that's funded through the Family Violence Prevention Services Act of Human Services, of Health and Human Services. So I work for the national arm of Casa Esperanza, and I'm based out of Alexandria, Virginia. And I'm also one of the representatives from CASA that advocates on Capitol Hill. I also teach victimology and ethnic studies at the University of Texas in El Paso, which is my university hometown. So I'm very excited to be here with you all. I've done a few of these language access curriculum, and so it's nice to refresh my memory on the importance of this curriculum and to share this with you all. So the learning objectives for this, this webinar is that we'll explore the information that is needed in order to develop and implement a comprehensive language access plan. And so I'll tell you right now, the money slides are towards the end of the presentation, so I'll ask that you hang on with me towards the end. And we'll also go through a few of the tools and resources available that will help you implement a language access plan. What you'll notice throughout the presentation is that you actually have a lot more tools and resources at your disposal than you actually realize. And so that falls in line with our values that we'll ask that you focus on your social capital, try to gather resources from what you already have in order to learn more and develop a language access plan. It's really important to first think about where your organization stands with regards to language access. Are some of you unsure? Are you beginning to talk about it? Are you working on developing a plan? Have you developed a plan and you're not sure if it's a good plan? Have you implemented the plan, and are you looking to enhance that plan? One of my major components of a language access plan where I like to focus is on monitoring and evaluation of a plan to make sure that it's doing the things that you want it to do as you interact with survivors from different communities. So who are individuals with LEP, limited English proficiency? Those are individuals who do not speak English as their primary language and have a limited ability to read, write, speak, or understand English. Many individuals with LEP are in the process of learning English, and so they may write, speak, and understand some English, but they might not necessarily be proficient. And as you all know, in the work that we do, it's incredibly difficult to make decisions on legal and medical matters without having, the appropriate information in the preferred language of the client. So this is particularly important. Who are the individuals with limited English proficiency in the United States? And this keeps increasing, and I'm actually really excited about new information that will come from the 2020 census. As of now, we know that 8% of the United States population is of limited English proficiency. And I suspect that this number will just keep growing. So California, Texas, New York, Florida, Illinois, and New Jersey account for approximately 2/3 of the limited English proficiency population. However, what we do know is that this is continuously growing. So this information is from 2013. And as I mentioned, this is just going to change as we collect more and more data. So the U.S. population over 5 years old, and these indicate the languages spoken at home. And so you see a substantial portion of the pie chart indicates that about 80% speak English only at home. But you see some other slivers of language, like Indo-European languages, which is about 3.6%. You see Spanish and Spanish Creole increasing at 12.85%. And then you see Asian Pacific Islander languages that are at 3.2%. There are some other languages. One of the things that we've noticed at Casa Esperanza is an increase in indigenous language from Central and South America. And so we are seeing a lot more individuals need those kinds of interpreters and translation necessary. And so you might be seeing that too in the work that you're doing. There's a number of languages spoken in Virginia localities, and we see this in predominantly 3 different counties in Virginia, which I'm sure you can confirm. We're seeing differences in languages in Fairfax, Prince William County, and Loudoun County. And so we're seeing localities with less than 10 languages spoken, and then this is changing, dramatically. So we're seeing more and more languages spoken in different Virginia spaces over time. And so here you have a graphic that shows 2005 to 2009 in gray with localities with different spoken languages. And then you see a change with the number of languages that are actually spoken at home. So we can see that there's dramatic change happening in Virginia. So if we look at the different Virginia localities, what we'll see are some of the different languages spoken at home. While English and Spanish are still the predominant language that are spoken at home, we're starting to see a change now. So you see French, German, Korean, Italian, Chinese, Tagalog, Arabic, I think Arabic is substantially higher than what we're seeing from this figure, but like I mentioned, the data is a little older from 2013. So some of the numbers that I've seen show Arabic a little bit higher, especially from 2018. I'm curious to see, you can always send me a question or post a chat about the languages of the populations with which you are interacting with. I'd be very curious to know that. So why provide meaningful access? You know, this is where we get to the heart of the conversation. I'm not sure how many of you all are familiar with Daisy Garcia's story. Daisy actually contacted the New York Police Department in May of 2013, and she was fearing her husband. Then she contacted them again in November of 2013 after an assault incident. Both of the times that she contacted the New York Police Department, she did so in Spanish. And her reports were never translated from Spanish to English. So there was no follow-up. There was reports of the record, right, of the complaint that she had made, but there was no follow-up. No one reached out to her. No one provided her with services. And so she and her two daughters were actually killed in January of 2014. And so this is an example of how quickly these situations escalate. Like, we know this given our backgrounds and where we work. But this also points to the fact of the extreme outcome that can occur when we don't focus on providing meaningful language access, right? This is where we can prevent harm, you know, trauma, death to the people that we provide services with. So I encourage you to keep this story in the back of your mind as we continue to go through some of this information. I'm also happy to provide you with information about the case if that is helpful. It's worth mentioning that the New York Police Department had to settle on this case, but it's just one of those extreme cases and circumstances. So the fact is that providing meaningful language access is a legal requirement. Any organization that receives federal financial assistance, either directly or indirectly, is required to comply with Title VI of the Civil Rights Act of 1964. And this is also outlined in the Omnibus Crime Control and Safe Streets Act of 1968. So if an organization receives any federal funds, then all aspects of that organization are obligated to take reasonable steps to ensure that individuals with limited English proficiency have meaningful access to benefits and services provided by the organization. And it's my understanding that my colleagues from your previous session, Jose Juan and Ana, provided you with a little more background on this. It's from Title VI of the 1964 Civil Rights Act. No person in the United States shall, on the ground of race, color, or national origin, be excluded from participation in, be denied the benefits of, or be subjected to discrimination under any program or assistance receiving federal financial assistance. And this is still relevant today. Interestingly enough, we still have the requirements outlined by Executive Order 13166. And this executive order requires federal agencies to examine the services they provide and identify any need for services to those with limited English proficiency, and to develop a system to provide those services so individuals have meaningful access to them. And this requires agencies to develop language access plans. The executive order also requires that federal agencies work to ensure that recipients of federal financial assistance provide meaningful access to their LAP applicants. So the law is quite clear on why we need to provide meaningful access. You know, any agency that takes federal funds is required to provide meaningful language access. So requirements for recipients of federal funds and federal agencies: if an organization receives any federal funds, it is obligated to take reasonable steps to ensure that individuals with limited English proficiency have meaningful access. Again, this is a priority. So additionally, and in line with CASA's overall values, it's the right thing to do. Our work is about ensuring safety and healing and justice for those harmed by violence, and providing them with all of the information they need to make the best decisions for themselves should be at the top of our list. Additionally, one more slide, it is the right thing to do because being proactive so that we ensure all individuals with limited English proficiency have meaningful access to critical services, right? As I mentioned previously, it's difficult to make decisions when you're not sure about the information you're receiving that's in a different language as it relates to legal and medical situations, which affects so many of our victims. So this is critical information. Additionally, providing meaningful language access provides improved services and enhances outcomes. Research has shown that domestic violence survivors with limited English proficiency are more likely to seek out services in those services when those services are provided in their language. Language access also enhances safety. If you consider that without language access, the survivor cannot interact fluently with advocates or other service providers and systems, much in the case with Daisy Garcia. And research in the domestic violence and sexual assault field shows that survivors appreciate and feel more supported when English access services are provided. I found this in some of my own research as well, and I'm happy to provide you with more information about the outcomes of providing language access services to survivors of domestic violence, if that would be helpful. So, developing a language access plan, are you ready? And I hope that I've given you enough background to get you thinking about your agency. So, a language access plan is a directive that sets forth standards, goals, and expectations for an organization on the provision of accessible services to limited English proficient individuals. So a language access plan is a plan like anything else that you would develop within your agency. It is the policy of this agency to provide, and this is an example, to provide timely, meaningful access for limited English proficient persons to all agency programs and activities. Right, so that's clear. All personnel shall provide free language assistance services to limited English proficiency individuals whom they encounter or whenever a limited English proficient person requests language assistance services. All personnel will inform members of the public that language assistance services are available and free of charge, and that the agency will provide these services to them. So this is an example of like a big overall way to approach a language access plan, right? You clearly laid out the goals, that you will outreach to community to let them know that these services are available and free of charge, and that the agency will provide these services to them. So that's just one example. But it is an incredibly complicated process, right, to think through a language access plan. And so these different steps help you achieve an overall language access plan. So a language access plan is made up of a variety of different pieces. All of those pieces are equally important, And agencies are just in different places and spaces to be able to get to that overall language access plan. So you'll see that in some of these steps, we talk about identifying and convening a functional work group, assessing the needs of a limited English proficiency community, collaborating with community and other stakeholders to provide these services, describe timeframes, objectives, and benchmarks, identify people who will implement the plan, and now I'm right at the center of the slide, identification of funding and procurement strategies, and we put it at the center because this is an aspect that gets a few people really stuck. So we'll talk a little bit about that. How to formalize a plan, how to implement, how to train staff on policies and procedures, and how to outreach to let survivors know of these services. And then, of course, as I mentioned, my favorite, monitoring and updating of policies and plans and procedures. So we will go through this information to get you to a good working spot. So as you begin, as you're probably thinking now, it's important to identify staff members that would be actively engaged in the process of developing the organizational limited English proficiency plan. So think about who needs to be at this table in developing your language access plan for your agency. Who's going to lead the initiative? And then the responsibilities of each staff member. So not just the people that are making and developing this plan, but everybody on staff. How are they going to be involved in this language access plan? So we want you to think about the benefits to increasing language access. How important are the services we provide to the lives of people who are seeking our services? The cost of not having language access. The concerns about increasing language access. And how can having a language access plan help alleviate those concerns? And how is developing a language access plan consistent with the mission and vision of your organization? So these are really, big questions, and it's helpful if the people that, from the previous slide, the 4 to 6 staff members that are going to develop and implement the language access plan, it's helpful for them to start at this particular point, right? Since these are really big, tough questions. Staff usually get caught up on the concerns about increasing the language access plan. Like, how are we going to implement this? What do we do? Whose responsibility is it? And what you find is that once you start implementing a language access plan, you can actually alleviate so many of the concerns that were that are kind of big picture things in serving your constituents. So as I mentioned in the previous slide, these 4 to 6 people that are starting to think about the language access plan development and implementation, think about who's in charge, who are you serving, what will be done, and I would add what will be done and like in what time frame, and maybe in what chronological order, right? Because there are some things that can be done almost right away, like translating some documents, which is just a first step in developing a language access plan. The next bullet point or the next dot point of who pays, as I mentioned, is another point that is really sticking to staff and folks, that are in your development plan, your development committee. keep in mind that federal funding, if you receive any federal funding, you're required to provide meaningful language access. And so in many ways, some of those funds should cover a language access plan. And so it's just a matter of budgeting and allocating services around providing meaningful language access. The next dot point is about providing notice and outreach, right? How are you going to let people know that language access services are available in this, in your organization as the services you provide? What kind of training will you provide your staff, and who's going to provide that training? This is a great conversation to have with like stakeholders and other partners. Monitoring and updating policies. At one of the previous places that I worked, we used to have an executive director who would call and only speak Spanish to see what kind of service she would get. At times, that executive director would actually have other friends and colleagues of her call and try to get services in other languages. So monitoring and updating policies can be fun, but it is necessary. And then collaborating with other supporting communities and LEP communities is going to be critical, because we can try to develop language access plans all we want. And if it's not resonating with our communities, our survivors, and our stakeholders, then our efforts aren't going to mean too much. And so it's incredibly important to collaborate with supporting members, community members. One of the cool things that I've actually seen done with supporting community members is like a focus group after implementation has happened, just to make sure that the information that was translated and or the information that's being provided is actually useful and valuable and meaningful. So after forming a committee and talking through some of these big issue questions, then it's helpful to identify languages spoken in your service area. So I mentioned a little bit about different counties at the beginning of this presentation, but it's really helpful to find out more about the portion of limited English proficiency individuals eligible to be served or likely to be encountered by your particular program. So who are the people in the community you serve, and what portion of them would benefit from the development of your language access plan? So we put together here quite a bit of resources that might help you start to answer that question. It's helpful to review census data for current immigration populations and look at their predicted populations. So we're using here 2010 data, but of course, we're getting ready for the 2020 census. And the 2020 census has provided some really interesting resources in different languages that might be helpful for your agency to review as you prepare for your language access plan. The census data also has language information through their socio-ethnographic data that is helpful. We provide you with some table resources in the presentation slides. Now, one of the questions that we often get when we do these kinds of presentations are, what about the census is good for kind of big picture stuff and for macro level understanding, but how do we get information on local immigrant populations? So one of the cool things that we provided here is how to conduct a Google search using key terms. So you would put in English limited proficiency, immigrant and refugee, and then your town and your city. And you could do that by zip code, or you could do it by the name of your town or city. Local government, school districts, local colleges and universities are also great resources for obtaining data. Libraries also have pretty good information because they can tell you what kinds of materials are being requested or most used or more checked out by certain populations. And then, of course, this is where we come back to the previous point of collaborating with local community members and stakeholders that will really give you more information on the languages spoken in your service area. So I want to identify the top 3 to 5 languages other than English spoken by participants who come into your program, because those are the folks that are most likely going to interact with your program. Some additional helpful tips are to review your program's demographic data to see what kind of individuals with limited English proficiency you've contacted or have tried to access services or that you've come across. Do you want to pull some numbers from aspects of your program, like if you have a hotline or shelter or support groups or other outreach materials? Like, you know, which are the materials that get picked up the most in what language? What kind of language requests do you get from your hotline callers or from the shelter? And also consider that individuals with limited English proficiency may not be aware of your program or may not believe that they can access your particular programs. And so think about how you might address some of those concerns. A service area assessment might be your next step on who is your limited English proficiency population. How does that population come into contact with your organization, right? Like, do you normally meet them when you're out in the community doing health fairs? Do they call your hotline? Do they seek shelter services? Is it a referral program from other organizations? And then how is your organization serving limited English proficient populations? What kinds of trainings do you have for staff that are in place? How do you reach these populations? And generally, what are your policies and procedures? You know, the policy and procedures aspect is easier to do because you can go through your organization's employee handbook, right? You can start pulling some of that information. But there are some other questions, like on how you reach limited English proficiency populations, that might vary depending on who's on your staff, right? So if you have 1 or 2 folks that are really passionate about a particular population in your area, then you might be really relying on them to help you reach, you know, certain populations. But also looking at some of the bigger pictures of like policies and procedures might be really helpful too. Step 3 is assessing current language access practices. So how are you currently serving speakers of the languages identified in steps 1 and 2? So look at your current language access practices. What do you currently have in place? How are you providing services to those individuals with limited English proficiency? So in this graphic, we have a neat kind of older chalkboard graphic, right, that shows 2 individuals communicating by what used to be kind of like the telephone game. And one of them is saying, "Do you speak English?" And the other is saying, "Yes, I speak English." And so I like that graphic because that's really the kinds of things that you have to think about. What happens when your agency gets a caller that is limited English proficient? What do you do, right? And so that's a question for like your front desk staff or the person that first interacts with someone of different populations, right? Like your public-facing person. And then, of course, different staff with different roles are going to have different parts of the plan that they have to implement, right? So thinking through all of that's important. Some helpful tips in assessing current language access practices: identify your organization's strengths and weaknesses in providing access through meaningful language services. Remember to engage the entire staff in the process of identifying current processes. So there are some things that your front desk person might know, but the person that does finances or accounting in your organization may not know. And so really having broad conversations with the entire staff is very important. Conducting a confidential survey to ask staff their own language skills, as well as which languages they need more assistance in, like, accessing. That would be really helpful. And then use what you learn to drive policy planning, hiring, and training. And those are some really helpful tips for step 3. Think about who participated in the development of your organizational language access plan. Where in the plan do the self-identified needs of survivors show up, right? So, of course, it's important to talk with your staff and figure out what their needs are, but also to talk to the populations that will use your services as well. And so where will the needs of survivors show up as you're gathering this kind of information? Additionally, in your analysis, which language groups were identified as needing to be prioritized in your organizational planning, and what steps in the plan resulted, from that analysis? So if you're seeing certain populations come into your area more so than others, then that means something for the way in which you prioritize language access, right? And so what specific steps can you take to assist in that new population that's perhaps coming to your area? And then the last dot point is, of current efforts to providing language access, where and how has your organization been successful? How can you build on those successes? So these might be small victories or really large, substantial systems victories. But what did you do really well, and how can you expand on that one time or the several times that your organization has provided fantastic services on language access? Step 4 is about planning, right? So we've talked about gathering resources up to now. And so step 4 is the services you provide are critical, right, to a person's mental and physical and emotional safety. And so you have to take reasonable steps to ensure that individuals with limited English proficiency have meaningful access to that same service, right? So if the goal is to provide physical and emotional safety for predominantly English speakers, how do you do the same thing for those that don't speak English at the same level? This means that any individual with limited English proficiency is not denied the opportunity to access and obtain the services and supports necessary for their safety as a result of language barriers. So if you are providing one support group, for example, and you have someone of limited English proficiency that wants to participate in the support group, we're going to need to find a solution so that that person can also participate in and have the opportunity to access and obtain the services that would have been provided to predominantly English speakers. Does that make sense? So planning for meaningful access for victim advocacy programs and services are critical for victim safety. And so we have an obligation to provide meaningful language access service. And so some options are to hire a bilingual or bicultural advocate, hiring interpreters, or having them on call. Like, you could either have them on staff or as the next dot point indicates, you could contract with a language line or have a contract with interpreters who consult or who provide interpretation services as well. So these are some options to consider. So taking reasonable steps. Sometimes this can seem really overwhelming, right, to develop a language access plan. So taking reasonable steps. What does reasonable mean in your particular context for your organization? And this is dependent on the demographic assessment of your organization's service area and the most commonly encountered languages. Reasonable is going to look very different for each organization. Reasonable requires balancing the needs of the individuals with limited English proficiency services for those who need critical services, while at the same time not imposing an undue burden on your agency and your organization and, of course, your staff. And then having a proactive plan in place to address the needs of individuals with limited English proficiency. So we get quite a few questions about like a one-size-fits-all language access plan, and that's just not reasonable, right? Reasonable is going to look very differently across the state of Virginia. And so we encourage you to keep that in mind. There's no one-size-fits-all model. This usually involves having multiple strategies, like hiring bilingual and bicultural advocates, translating written materials, using telephonic interpreters when needed, using in-person interpreters, establishing co-advocacy partnerships with community-based programs, and establishing a language bank. So for co-advocacy and partnership, one of the cool things that we've seen done is to train interpreters on trauma-informed approaches. And then in turn, you now have interpreters that can be particularly sensitive to the populations with whom you interact with, right? So because you can do some cross-training, or they can provide, some key words, a training on the way in which they assess interpreter services or quality. Does that make sense? And so cross-training is one innovative way, and it's also less expensive between you and the organizations that are already doing really good work and are established within the community. So allocating and building resources is step 5. Providing meaningful access to services and programs is required by federal law. The truth is that regardless of your budget size, you need to consider how you will provide language access services and access to services, and not whether you can provide them, but how are you going to make this happen? So developing a strategic plan that includes goals and benchmarks is going to be critical to enhancing and building capacity. Brainstorming, thinking through funding opportunities is helpful too, and this is where you can get your board of directors involved. Developing a concrete short-term and long-term goals, right, for language access. So maybe your first year of developing a language access plan, you're going to focus on predominantly Spanish speakers. And then the next year, you're going to focus on Arabic speakers, right? That's completely understandable and reasonable, right, if those are the populations that you're predominantly serving. And then identifying staff roles and responsibilities and carrying tasks out. I'm sure that all of us know that once you put somebody in charge, that all of a sudden things get done, right? Because one person is accountable and can usually carve out time to get things done. And so that's important too. Step 7 is formalizing the plan. And so by now, you've identified the language services you will provide and to whom, and now you actually need to write this down and put it in a plan. And that's probably folks' kind of least favorite thing to do, except for me, because I really enjoy writing policies. So in formalizing the plan, here are some 9 steps that are critical in taking. The first is to articulate what you're trying to accomplish, right? So if you come back to that kind of first aspect of a slide on how to provide language access, and this was slide 22, this is where you start with a directive, right? What is it that you hope to accomplish? And this could be a really big phrase, a big statement, right? We will provide timely, meaningful access for all LEP persons, is an example. Then you want to describe how meaningful access supports and is connected to your organization's mission. Number 3 is articulating your reasons for establishing a policy. You know, and of course, the legal mandates could easily go in there. But also in wanting to be preventive and serving all, in doing the right thing. Step 4 is developing concrete policies and procedures that instruct and guide your staff. So what are the things that each staff member needs to know? And then how do you disperse that amongst the different roles within your staff, right? Step 5 is specifying when and how language services will be provided. So there's usually a few steps, right? Like, okay, someone calls and needs services in this other language. How do we go about that? And so there's, number 5 should be a step-by-step process. Number 6 is about incorporating how staff will identify the language a person is speaking. It's helpful to have language cards where people can point to the language for which they need services. That's a very useful and a kind of practical way to identify the language that someone is speaking. Number 7 is how will you find interpreters? And going hand in hand is the next step, number 8, which is assessing the interpreter's skills, right? So not just finding any interpreter, but really having a quality control aspect of interpreter skills. And then the last step is assessing language line interpretation, right, which is very similar to step 8. How do you know that the interpreter is doing a good job? You know, does the client seeking those services look confused? Is the interpreter taking a long time to provide interpretation? Those are just some indicators. So you started thinking about this plan, you know you have to write it down, and so here are some tips for formalizing a plan. Help identify your agency's organizational goals for what you're trying to accomplish, right? So try to be specific here. Build and understand how meaningful access supports your organization's mission. Clearly articulate your intentions for formalizing a plan, and develop concrete policies and procedures that instruct your guide on how to implement the plan. And so maybe in part of that plan is thinking about worst case scenarios, right? Of like, how can we prevent, or what would we have done differently in looking at the Daisy Garcia case? Some other helpful tips are specify when and how language access services will be provided. Indicate how staff will identify the language a person is speaking. Have a list of like potential interpreters, right, that you can easily call and access. Perhaps you know their rates that they charge, so you can contact them easily. And then provide tools and processes for assessing that interpreter's skill, right? Depending on the kind of service that the limited English proficiency person needs, can dictate the level of expertise from an interpreter, for example. Step 7, planning for implementation. Exploring how your organization will implement the language access plan throughout the agency and organization. So it's helpful to think about how you know, your front desk person or the person that interacts first with the public will implement language access, but that's going to be different from a caseworker, right? That's going to be different from your executive director, for example. So thinking about all the various steps and roles within your organization and how they implement language access is definitely important. So which staff members will take responsibility for what tasks? Another helpful tip is an opportunity to include a glossary of language access related terms that you constantly see in the everyday of your organization. And then step 3 is an opportunity to identify additional policies that you would want included in your plan, right? This is important too. So how can we make this plan better after the first 6 months, after the first year, after 18 months? Training staff is also really important, because once your plan is developed and you have policies and protocols and the procedures have been updated, you want to make sure that your staff is familiar with the policies and what they're supposed to be doing. So developing a comprehensive organizational assessment, language access plan, reviewing relevant policies and protocols, and what to do when an unexpected language is encountered, right? Because once the public knows that you're providing language access services, you're going to get community folks that are needing your services from a variety of different backgrounds, now that they know that you're willing to help. What's the proper way to communicate with a supervisor using an interpreter? And practice, role-playing some of those scenarios would be really helpful. Clear guidelines prohibiting the use of family members, children, and other participants as interpreters. We have some of those if needed, and I'm happy to pass those along. And then tip 4 is a mechanism for training new staff as they're hired, and refresher courses as circumstance changes or there's new tools or resources are identified. So these are some helpful tips to think about getting staff trained. Also, it's necessary to think about how you work to develop a mutually beneficial partnerships with culturally specific organizations to enhance language access to survivors. So how could these efforts be strengthened, right? And you want to have an organization in mind that you can call, when you need interpretation, but also that, as I mentioned previously, maybe you help train some of those folks in trauma-informed interpretation or trauma-informed services, right? And so then it's mutually beneficial both for you and the culturally specific organization. You also want to think about how you and your partners measure progress, right? What are the benchmarks that you've established? Like, how do you know that you're actually serving the population that you're meant to be serving? And what does progress look like? Does it mean that you see 10 more people a month with different language needs at your organization? And is that what's going to show progress for you all? Also think about how are staff trained and utilize the plan in their day-to-day work. Like, how will you know if they're successful, and how will they know if they're successful, right? Like, does somebody get a positive reinforcement or a positive shout out if they adequately answered the phone and troubleshooted correctly, when they came across a limited English proficient person that needed services? Like, what are the ways that the staff will know that they're doing a good job? Step 9 is about community outreach. How do you notify individuals with limited English proficiency of their rights to language access and the services that you now are making available to them? Community outreach, the first tip that is probably the most important is to be inclusive and to invite culturally specific organizations to meet and discuss the services available and to assess the barriers as they see it in providing services to those communities, right? Because culturally specific organizations are going to be the experts at reaching organizations that might not be coming to access your services. So you definitely want to be mindful about what they have to say. You want to build relationships with allies in the community. Perhaps there's a particular elected official that is very helpful in this instance, for, another organization that you see doing really, really good things that you want to partner with. It's helpful also to hold community informational workshops on topics important to community members. So, for example, it might be helpful to have like a workshop on healthy relationships, or maybe on legal remedies, maybe on healthy child development. I've seen cooking classes be incredibly helpful, and or diabetes prevention as well. So these might be some ways to have an informal or an informational workshop on particular topics relevant to your community. Creating a public service announcement to be featured on a culturally specific radio station or public access station might be helpful. It depends on your budget and whether or not you have a team that could make this happen quickly and efficiently. Going to where community members are, so places of worship, schools, community centers, work centers, those might be really helpful to reach limited English proficient communities and or culturally specific organizations. And number 6, just as important as number 1, is go where the community is. Do not expect them to come to you. You want to think about, how do your partners provide accurate, consistent messages about help that is available to survivors with whom they interact? How do they help you do the same? So what is it that partners are doing really well that you could learn from and that might help you in reaching a particular population? And how does your organization, the Language Access Plan, reflect an understanding of where in the community survivors with limited English proficiency show up? So how does it reflect your awareness of the unique challenges they face? So for example, when I was doing some data gathering in the Washington, D.C. area, I noticed that all of the Spanish speakers that needed assistance with domestic violence services would go to one shelter. Even if they lived in a completely different area of town, they would get to this one place. And this is because the bus routes were easier to get to this one shelter than it was to get to the shelter that might have been, 10 blocks closer. And so that is how you can reflect on the unique challenges that a particular community might be facing when accessing your services. And then the last thing to think about is, how does your language access plan reflect an organizational commitment to being accountable to culturally specific groups for successful expansion of services, to access of services and support? So what kind of organizational commitment are you all making that is actually meaningful to the community that you're trying to serve, right? And how are you going to make sure that you are fulfilling that commitment and are living part of that mission, of your mission? Monitoring and compliance, this is step 10. This is my favorite one. So once you have a comprehensive plan to provide meaningful language access, the next step is to follow up with a built-in plan to monitor the implementation and effectiveness of your language access services. So probably the reason that I enjoy the monitoring and compliance the most is because you really get to learn if what you thought would, what you set up would actually solve the problem. You get to actually figure out if it does. So the first tip of monitoring and compliance is to establish an annual review of your plan. So if you're implementing a plan starting September 1, you want to set up a review the next August, right? And you want to examine how the demographics have changed, how your plan affected the services. Did you respond to the language needs as they came up, or were you able to be a little more proactive? How did you address the unexpected languages? How should you adapt or change for the next year? How are you progressing on your language access plan to build capacity in the long term? Are you fundraising? Do you have a participation satisfaction, survey or any survey after you engage with a limited English proficient person? Are you hiring staff? Have you included, bicultural and bilingual aspects within the job description that you are now, as you're hiring? And how are you continuing to train staff? And then the last helpful tip on monitoring and compliance is to include the input of staff, participants, and partners engaged in the plan by using listening sessions, surveys, interviews, other feedback tools like a focus group to gather information about the experiences that folks that are of limited English proficiency are having with your organization and your services. So in putting it all together, you can go to www.languageaccessplans. Casa de Esperanza does have a few resources, and we're actually redoing our website on language access. So you'll find some different resources. We believe in monitoring and compliance as well, and so we focus also on bettering the resources that we provide for you all. So there you can find information about plan implementation, what to do to enhance your plan, what are some ways in which you can think about changing systems that also have a direct impact on language access. And so we provide some additional resources and samples as well. So I encourage you to check that out. And then I mentioned that the money slides were going to be towards the end of the webinar, and so here we are. Here are some slides on developing a language access plan. So you want to start with a general policy statement, right? As I mentioned, slide 22 has a general statement. What is your organizational policy regarding serving individuals with limited English proficiency? Then you want to mention the purpose and authority. How will this plan connect with your mission? Why are you establishing a language access plan? The next component of a language access plan is about language assistance measures. How and when should staff provide language access? What are the guidelines? What are the specific things that they should do? What resources are available to them? Who can they contact? And at what point in the interaction should they contact? The next step is about notification of language assistance services. And so this relates to how participants or potential participants learn that you have language access services. Are you going to advertise through organizational brochures or advertisements, put up flyers at community centers, or mention this in crisis line, or how are you going to get the word out? That's an important part of the notification of language access services. Next is staff compliance. What are the responsibilities and requirements of staff members to provide language access for service provision and outreach? And you want to be as detailed as possible, right? Since ideally this will become part of staff, like annual reviews. What is the plan for improvement? What are your strategies for enhancing access to services for individuals with limited English proficiency? Right, we can always do something better. What are the definitions? What helpful terms should you define both for staff as related to limited English proficiency, primary language, translation, interpretation, bilingual staff? What key terms should everyone know, and or where can they find a glossary within the language access plan? And then there's a section for additional language access policies. What additional policies should staff and participants know about related to how you're going to implement your language access policies? So here you would include additional or specific policies like on staff training, policies for hiring bilingual staff, ways of doing community outreach. And then we provide you with a sample. This has general statements, right? So as I mentioned, the general statement from slide 22, we provide you with some examples of the purpose and authority. So for example, here we have the purpose of this policy is to establish effective guidelines consistent with Title VI of the Civil Rights Act, right? So I mentioned that you would include the legal components of language access in this portion. Then it's helpful to put in language assistance measures, like this organization is committed to assuring clear, confidential, two-way communication with clients and potential clients. Remember that confidentiality and privacy are still relevant for language access for limited English proficient individuals. Next, we give you an example of a notification of language assistance services. So for example, in all of its intake areas and on its website, this organization will post and maintain clear and readable signs in these languages. And this helps notify people of the service that you're providing. And we have an area for staff compliance. So for example, here we have all personnel will inform members of the public that language assistance services are available and free of charge to limited English proficient persons, and that the agency will provide services to them. There's a little section on plan for improvement. Our services are critical to the physical and emotional safety of survivors. We take reasonable steps to ensure that all survivors with limited English proficiency who seek our services have meaningful access to services. Definitions that are helpful are interpretation, which is conveying information orally from one language to another, and then translation. Sometimes people get these confused. Translation involves conveying information in written form from one language to another. And it could be multiple languages, right? It could be that, someone has to translate from an indigenous language in, Central or South America to Spanish to then English. And so translation and interpretation could happen, not just going from one language to another, but from one language to another to another. And then additional language access policies, like any additional steps that your organization will take in order to meet the needs of survivors and community members that need language access services. So you can find additional tools at languageaccessplans.org, and there are bilingual tools. Well, it looks like we went ahead a slide. Bilingual tools to help your organization create language access plan, and some step-by-step materials to help advocate for survivors of limited English proficiency. One of the cool things that the National Latina Network has done is provide a toolkit on language access within courts. We're happy to provide that as a resource if you all need it as well. And we are nearing the end of our presentation, so I am happy to take questions. If you have any, this is a good time to chat. If you have additional questions as well, please let me know how I can be of service and make sure that we continue to provide information to you. I want to thank you for your time, but I'm happy to take questions now. I see some questions.
I see one that says, I was just wondering if you had any ideas in case of how staff could identify language over the phone.
Yeah, that's a really great question. And so I've heard of different agencies having something similar to what you get when you call, like, I don't know, for example, I called the bank this morning and they have, for in Espanol, press 1. Do you know what I mean? And so you could do that as well in different instances on the phone. And so you could have these pre-recorded messages that allow people to then respond.
Okay, it has, our concern is people that do not speak Spanish or English. That's the same question.
Right, so you would have a pre-recording for a variety of different languages that are relevant to your region, for example.
Can you go into a little bit more detail about pre-recording?
Yeah, so you can have something, very similar to like when you call your bank, right? For this, press a button when you hear the language that you want to speak. And so ideally you would have 3 to 5 languages identified within your area. Does that make sense? And once they hear the language that they want, they can push a button.
You're right. It's complex because would they understand that instruction? That's what complicates it. Right.
So you'd have to say that in a variety of different languages. That's the only tough part.
Mm-hmm.
Yeah, I'm happy to come up with some other creative solutions. Sometimes, with Jose Juan and Ana, sometimes they have additional, things that I haven't come across. So I am happy to ask my colleagues and circle back.
Okay. And then people keep asking about the PowerPoint, and we will have all of the resources and the recording of the webinar available very soon, and we'll make sure that everyone gets notified of where they can access that.
Perfect. I'll include my contact information when I send you the slides.
Okay. And we still have 10 minutes. If there are any more questions, now's your chance. Okay. Well, Olivia, I don't see any further questions, so I'd like to thank you on behalf of the Office of Family Violence and all of the programs in the state of Virginia for your help today and in the future. We appreciate our partnership.
My pleasure.
With your agency.
Oh, it's absolutely my pleasure. Please let us know how we can continue to provide services. And we're always happy to answer individual questions and are so thankful for you and your time.
Yeah. And just to remind everyone what I mentioned in the beginning, that we have the technical assistance calls, which Casa de Esperanza will also be sitting in on. And the next one will be Thursday, November 21st from 12 to 1. And there are details about that in the email that you registered for this webinar on, and we'll also resend those out to remind everyone. Thank you for coming today. I'm going to turn the webinar off now.